Stem cell success, what to expect from your first treatment. Hi, I'm Josh with Dream Body Clinic, and that's a good question that we get asked very often, and it does depend on the treatment. And if you look at our website at www.dreambody.clinic, you scroll down on the homepage, I've got all the treatments listed. I mean, there must be like 70 different treatments listed. So there's a lot of different things, but they're pretty easy categories. There's joints, there's autoimmune diseases, chronic degenerative diseases, and then there's some kind of abstract ones for maybe brain health, gum health, facial, more vanity stuff. But with any of them, we do our best to set up the protocols that we have listed. Our goal is to make this a one and done type thing. We're hoping that if you come to us, we've pre-qualified you, made sure you're a good candidate via phone consultation, usually with me or the doctors, to make sure that we can help. And if we can, we're hoping it's one-time treatment. Like if you got bad knees, we're hoping one time. Hoping if you've got an autoimmune disease, it's going to be one big IV, knock that thing out, and hopefully maybe never have to do another IV, or if you do, it's not for many, many years. So that's our goal, but it's not always the case. So the best examples are like knees, the most common thing we treat, and this applies to any joint. If you have arthritis, which is the diminishing of cartilage in the joint, that gets tougher the more advanced it gets. So if you're like stage 1 or 2 arthritis, that's almost always a one and done treatment. We can regenerate enough, if not all the cartilage, to where you're just feeling perfect. The stem cells will first get rid of any scar tissue, get rid of the inflammation, and then start regenerating the cartilage. But if you are stage 3 or 4, then there's a high chance it's going to take more than one treatment. And that becomes a thing where at stage 3, I have seen patients at stage 3 arthritis get all the way to 100% with one treatment. It's not that common. It's maybe a 50-50 shot, but it can happen if you really do the rehab properly and focus. And we provide a really comprehensive rehab protocol and suggestions to do. So that's where we're there. But a lot of those patients will need to come back maybe a year later for another shot to get 100% if they want to, because we can usually get them from stage 3 down to stage 2 or stage 1. And that's still a world of difference from stage 3, especially when the inflammation's in full effect, the pain is there. We can reduce the pain and inflammation and get them pretty good, close to perfect, right? Now, if you're stage 4, that's typically what they call bone on bone. That gets more difficult. And I don't think I've ever seen a patient get 100% with one treatment with that. We wish we could, but that means you waited too long. But again, going from 4th degree to 3rd or even 2nd degree is a world of difference. Pain, inflammation, major reductions, if not elimination. And then it becomes more of, hey, I know it's not perfect. Maybe I go back just to get it so I know it's all the way. And we do MRIs for all of our joint treatments. It's required. We have our own MRI machine here on site. Scan it, see exactly where it's at. This way you know what's going on and you have something to compare to in the future so you can really see the results. So if you go to our treatment pages, you can see videos with patients. We can actually see how we took someone from, 2nd degree arthritis or worse and got them healed. So that's all there for you to take a look at. Now with autoimmune diseases, it comes down to how long you've had it typically. I'd say 80% of the people we treat get the results that they're looking for, and that applies to joints also, unless it's stage 3 or stage 4. And about 15% of people will see improvement, but maybe not 100%. Those are the people that may want to come back. And we don't recommend for any treatment coming back any sooner than 6 months. And that's because we typically see peak results 3 to 6 months post-treatment. So you need to give it that time. This is cellular regeneration. We're helping build back new tissue. It's like if you cut your arm, that it's going to scab over and start healing. It's not going to look perfect again for maybe a few months. Same thing on the inside. It takes time. With the autoimmune diseases, it's going to reprogram your immune system, and it's not usually instant. Again, usually takes a few months to really kick in, but once it's kicked in, it stays there. We're seeing patients with like type 2 diabetes, ulcerative colitis, MS, rheumatoid arthritis, a lot of other things, lupus, fibromyalgia, do treatment, and 3 to 6 months later, they're symptom-free, and then they stay symptom-free unless they do something to flare it up or whatnot, which is rare, but can happen. So again, we're trying to make this one and done. We have found with those sort of treatments, so with autoimmune diseases or chronic degenerative, which would be organ health issues like heart, liver, kidneys, lungs, these sort of treatments in autoimmune diseases require, in our opinion, at least 1.4 million per pound of body weight. So 1.4 million stem cells per pound of body weight. So if you weighed, let's say 150 pounds, you know that would 150 times 1.4 is 200. So you need a 200 million IV. But if you weigh over 150 pounds, typically you need the 300 million IV. And every once in a while, we'll get some big linebacker or someone that maybe needs like a 400 million IV. Like I weigh 240 pounds, I'm 6'2". Ideally, for my body weight, I'd probably want to do a 400 million IV. Just a larger person needs more cells to do that. So the size of you does depend on the dose. And that's because it's sort of a parabolic curve that starts to flatten out at the top. And we found that at that dose, that's kind of the peak of that parabola. That's right where you hit before you start seeing diminishing returns. So for me, doing 800 million wouldn't give me double the results of 400. Right? It's diminishing returns. So we really want to hit that perfect so that we don't want people spending more than they need to just in hopes that they're going to get better results. We found that sweet spot to hit to make it as cost effective and efficient for you. Now, all of our treatments are listed on the website, www.dreambody.clinic. They're all there. You click on them and they've got prices, they got info, links to studies, patient testimonials. Everything's there for you to take a look at. So that's an overview of what to expect. If you go to the treatment pages, you can click through them and it actually gives you like more specific things to expect. I've got these videos for the knee treatment, the hips, the shoulder, the autoimmune disease, all the treatments have kind of what to expect, time frames, all of that. Now, this is medicine. We can't guarantee anything. Across the board, it's usually about 5% of people are non-responders. It sucks. We hate that, but it is medicine. Some people don't respond. Fortunately, very low number. And when you compare it to most modern medical prescription drugs or even regular drugs, think like ibuprofen, one of the most common things you can get. Well, if you give 10 people an ibuprofen for a headache, I think the stats are something like 4 of them will get relief, and that's considered like, wow, amazing medicine. So our rate of success is much higher. And that's because we're using your body's own ability to do that. Mesenchymal stem cells essentially help you heal like when you were a little kid. We just have fewer as we age. So by putting them in number, we're getting you back that capability to heal like you did when you were a little kid. So that's what we do. If you'd like to learn more, again, go to the website, www.dreambody.clinic. You can call me toll free at 888-704-3977. I'm Josh. Happy to help.